And do you have very clear guidelines around the medications that are potentially for life and the medications that are to treat a current situation that they're likely to come off at some point?
Yeah, some medicines are for the long term. So that would be particularly bipolar disorder, which has been recurrent, and lithium carbonate. So stopping and starting lithium we don't think is very useful for people. And so if you're committed to that, usually it's for a longer term. Um, Other medicines, so ADHD medicines, we would usually say it's a year by year prospect. So by adulthood, about half of people will have developed out of ADHD, but the other half will have still significant issues, and you don't know who's going to develop out when. Often it's pretty obvious whether the medicine's still required or not because people have an onset effect. It starts working, you can see that, and it stops working at 4 p.m. or 5 p.m. or whatever, and it's obvious. But if it's not obvious, it can be useful to have a trial off each year. Usually term 2 or term 3 when schools know what the young person's like, and they can see if there's a deterioration, but most parents would know anyway. Um, and then SSRIs, we would usually say continue them for 6 to 12 months after an episode of depression and then have a trial off. And then recurrent depression, it may be that people are on for the medium to long term. Similarly with anxiety, we'd say much the same thing. Um, so it kind of varies a little bit. Most medicines we will attempt to try and get people off, and then if they have recurrent issues, then it's quite likely for the medium term. But nothing's forever. Even lithium, people sometimes will go off there quite successfully after a period of stability. And, their life's more settled and there's less stresses and things.